Good evening, class. As you can see, I will be discussing technology and the revolution of elderly care. As I go through the presentation, I will discuss the 5 questions we have been answering over the past 7 weeks. Most of the questions overlap with each other, but first I would like to tell you how I chose this topic. I first started with technology in the kitchen. A few examples such as self-cooking stoves and robotic chefs, only because I am a chef myself. And I went into research with strong opposition as I was interested to see how my skills could be computerized. But as I dove deeper, elderly care kept popping up in every article, and being that I will be older one day, I changed my perspective. Before we get started, here are a few statistics on the ever-growing elderly demographic. According to the National Institutes of Health, 8.5% of the world's population are 65 and older. That's 617 million people. And by 2050, this percentage is projected to jump to nearly 17.6, 1.6 billion. Ages 80 and older will quadruple. According to the U.S. Census Bureau, in the United States, 14.5% are 65 and older, and by 2030, it is projected to grow to over 20%. Baby boomers will also outnumber children by then as well. The average U.S. life expectancy increased from 68 years in 1950 to 79 years in 2013. With those numbers in mind, technology will definitely play a major part in keeping us here longer and by helping us become more independent. To understand technology in this demographic, I have placed the effects of it into 3 categories. The first category are the health effects. As we age, we suffer from more ailments, placing an increasing demand on the health systems and our families. The second category are the economic effects. There are more seniors working past the retirement age of 65, staying at home instead of assisted living, and also being caregivers to grandchildren. This is a very specific topic as there are so many involved. Government resources, financial burdens, and employment and training of healthcare professionals, to name a few, are also economic effects of this growing demographic. It is projected that there will be a shortage of physicians between 40,800 and 104,900 in the United States by 2030. The last category are the social effects. With this aging population, it ultimately creates an unsustainable burden on the household by way of physical and emotional burdens, which can in turn cause financial burdens. As you can see, one effect leads to the other. Family caregiving is more intensive, complex, and long lasting than in the past, and caregivers rarely receive adequate preparation for their role. A lot of evidence suggests that many caregivers experience negative psychological effects. Some are at higher risk than others, especially those who spend long hours caring for older adults with advanced dementia. Caregivers should have access to high quality, evidence based interventions designed to mitigate or prevent adverse health effects. Here are a few examples of diseases that require continuous supervision by a professional caregiver: atherosclerosis, osteoporosis, cardiovascular diseases, advanced stage cancers, diabetes, dementia, and osteoarthritis. Here we get into the question solutions of AI. First, we have at home monitoring. Examples of this solution are biometric remote monitoring, such as CarePredict, which uses Tempo, a wrist-worn wearable that houses a sophisticated array of sensors able to detect an individual's activities of daily living and location. while providing a touch button call system for real-time communication with caregivers. Tempo senses ADLs like eating, drinking, bathing, grooming, brushing teeth, toileting, walking, sitting, sleeping, and more. And it knows in what rooms those activities are occurring. When the integrated assistance button is pressed, an alert is sent to caregivers showing the exact location of the senior. Tempo also features a two-way audio communication between the caregiver and the senior for additional support. There is also Amazon and Orbita Health, which enables medication adherence and coordination for the elderly. And last, you have voice-based virtual assistants as nurses and caregivers. Next, we have smart device assisting, such as Apple and Fitbit, which most of us use now as wearable biometric trackers. Next up is smart device fall detection, such as Exens, Cardian, Covensis, and Livio. Another solution are virtual companions such as Catalia Health's Mabu, Intuition Robots Elite, CT Asia Robotics Denso, and Riken's RoboBear. And last of all is robot-assisted living, such as Calico, Insilico Medicine, and Neuritos, to name a few. Here we ask the question, whose problem is it? If you can recall, some of these items were mentioned in a previous slide, but here I will elaborate. I strongly believe that this technology becomes a problem for us all while helping us, and you will see later on what I mean. In this slide, I shed light on the healthcare system as they play a major part in providing the technology for elder care. First up are the healthcare systems. The U.S. spends more on healthcare services than any other country in the world. In a study done in 2015 by Avalier Health suggests that medical innovation does not increase the cost of Medicare. Reason being, adoption of innovative technology may result in cost offsets or cost savings by reducing complications in health resource use, influencing recovery time and patterns of post-acute care, and driving overall efficiencies. The results provide valuable insight into the potential economic benefits of adoption and use of medical technology. Next up is the government. Being that Medicare is government funded, the government is responsible for ensuring that the costs do not rise with technology, and they will provide solutions to offset the costs by funding more research, approving policies for affordable at-home technology, and providing the resources to educate more caregivers. Here I show you which people and what institutions I believe might be most helped by these medical technological solutions. And that is the individuals and the providers in hospitals that use the medical technology to become healthier and more independent, while lightening the load of the caregivers, as spoken of earlier. Being a caregiver has a trickling effect that can cause long-term issues. And with this new technology, as a caregiver, you're able to relieve most of the duties and stress or worry of your elder family member. What new problems might be created by solving this problem with this technology? Rising insurance costs. Medical costs have jumped more than 286% since 1985, while the consumer price index has jumped 121%. By 2035, a typical senior will spend one out of every $7 of retirement income on medical care. That's a 40% increase from 2012, and that's if they have a retirement fund. A study by Laura Hatfield, Thomas McGuire, and Michael Chernew of the Harvard Medical School and Urban Institute professor Melissa Favreau projected that out-of-pocket cost increases will hit poor and near-poor households hardest. By 2035, median out-of-pocket spending for medical care will rise from 10% of income to 14%. Next are rising education costs. The cost of higher education has surged more than 538% since 1985. And last, we have skilled professionals. Studies suggest that there will be a shortage of physicians between 40,800 and 100,900 in the United States by 2030. As you can see, the rising cost of these three things is cause and effect. And with new medical technology, it may help reduce ailments caused by age, but it may also cause a long-term issue with finances. What sort of people and institutions might acquire or lose economic and political power because of this change, and why? I've broken this down into two categories: losers and gainers. First up, losers. Policymakers debate whether to reduce federal contributions to Medicaid to reconstruct Medicare, which would require seniors to pay even higher costs. Second up, gainers. Insurance companies. By 2035, copays and deductibles will rise from 10 to 14%. In the middle, I've placed the older demographic, as they are both gainers and losers in this discussion. As you know, I've gone over all the positives and the negatives of technology in elderly care. In conclusion, regardless of which topic you choose when speaking of technology and its effects, there are always positives and negatives. Technology advancement is great, but it comes with a price, whether socially, economically, or financially. Hope you all enjoyed this presentation.